Hello everyone, my name is Victoria Sliz, and today I will be talking about dissociative identity disorder, or DID for short. This discussion will include talk about treatment, diagnosis, what an alter is, some of the controversies that are involved with this disorder, and how some professionals felt about this disorder in the past, and who knows, they may even still feel this way in the present. I would like to start off this discussion by talking about an article that I found called Psychotherapy and Pharmacological Therapy for Patients with Dissociative Identity Disorder. So dissociative identity disorder stems from prolonged severe childhood trauma. So this trauma can include sexual, physical, and emotional abuse. Symptoms for this disorder usually don't start showing until ages 5 to 10, but your first alter can appear at age 6. Now, I would like to quickly talk about what an alter is. So an alter is basically its own person. It has its own memories, it has its own feelings, it has its own name, it has its own way that it looks inside of its head. And that's basically what this disorder stems from, is these alters kind of shielding the host body from memories that they might not want to experience anymore. That's what their job is. There's different jobs for different alters, basically. So patients that have this disorder often have trouble with brief managed care because new alters can appear, and it's not enough time to really get the system grounded. So usually people with this disorder will go to therapy weekly or bi-weekly for many years, and the point of therapy is to try and fuse all of the alters back into one person while still keeping their memories intact, because like I said before, each alter has different memories. The most common therapy recommended for this disorder is cognitive behavioral therapy, as it, I don't want to say forces, but it kind of makes the alters and the host work together and communicate to find common ground, so that when they're feeling stressed or anxious, they don't resort to switching as their coping mechanism. This is good because switching is not a good coping mechanism for when you are stressed. It can just cause more stress to the system. There's also medications that are used to treat this disorder as well as cognitive behavioral therapy, and those are SSRIs and benzodiazepines. So the benzodiazepines are used for the anxiety and the feelings of stress, and that really goes hand in hand with the cognitive behavioral therapy, as it helps them to not switch because they won't feel as anxious. The next thing I would like to talk about is how professionals have felt about this disorder in the past. So there was an article done by the Journal of Psychiatry, and there was a study done where they asked 367 certified psychiatrists how they felt about dissociative identity disorder. Did they think that it should be its own disorder in the DSM-5, which now it is, or do they think that it should just be treated as a processed diagnosis, which is basically not its own diagnosis in itself? And only about 1/4 of the professionals that responded felt that it should be its own diagnosis. So the rest of them said that they didn't believe that there was enough scientific evidence to really call it its own disorder, and just more of a disorder that kind of like leads into something else, which is what a processed diagnosis is. So the next thing that I'd like to talk about is the controversial side of this disorder, which is how people used to believe that this disorder and borderline personality disorder were the same thing. They thought that dissociative identity disorder was just an over-dramatized version of this disorder, which is not true. Dissociative identity disorder, and I cannot stress this enough, is its own disorder. It is not a mixture of another disorder. This was proven by a study done that showed that people that have borderline personality disorder are able to recall where they were. They're able to have memories even when they are having a dissociative episode, whereas people with DID will not be able to do these things. They will struggle with remembering where they were, why they're places, why they're wearing certain clothes. So this is just like more proof that dissociative identity disorder is its own thing, and it's still very unknown, but I feel it's important to understand that this disorder is real and it should be treated as such, and we still need to learn way more about it. But I just wanted to say thank you for listening to my discussion, and I hope you all have a lovely night.